They say being alone isn't a bad idea. Being lonely is. As far as our generation is concerned, we are alone and lonely. At least that's why the World Health Organization has declared loneliness as a global public health concern. The WHO has equaled the impact of loneliness to smoking 15 cigarettes a day. And not just this, the WHO has also set up a commission on social connection to deal with this challenge. It will be led by American Surgeon General Dr. Vivek Murthy and the African Union Youth Envoy, Chido Pememba, along with 11 advocates and ministers, including Ralph Regenavano, the Minister of Climate Change Adaptation in Vanuatu, and Ayuko Kato, the Japanese Minister for Loneliness and Isolation. Now, here are some startling facts. 1 in 4 people globally are lonely. Not just the elderly, but 5 to 15% teenagers are also lonely worldwide. And this number might be an underestimation because of the low reportage on this. Loneliness is leading to dementia and strokes as well, other physical ailments too. Less than 20% people who feel lonely actually don't recognize it as a problem. Remember, loneliness is often seen as a problem of developed countries. But the high rate of 1 in 4 people experiencing social isolation is similar in all regions of the world. So on the show tonight, we delve deeper into this problem and the solution to it. I'm joined by Dr. Harish Shetty, who's a psychiatrist. Deepak Seni, stand-up comedian, also joins us. He's an actor as well. And Dr. Vikramendra Kumar, assistant professor, Department of Sociology in the Delhi University, also joins us. Good evening, namaskar, welcome to all of you. Dr. Harish Shetty, I'd like to start with you. We're talking about loneliness. As a psychiatrist, did you see this challenge coming for our generation and the generation to come?
In the last 5 years, I've been displaying a slide that loneliness is a disease. And many people in Bombay and India would object and say that it is not a disease, it's only a disorder. And I said, no. Globalization has adverse effects. And one of the adverse effects is loneliness. Because as we run, we do not look on both sides. Increased pace causes disruption of the orchestra of the body, thereby making us feel not to meet anybody. The emotional contact time in families has gone down. The family contact time has gone down. And long working hours and different stressors on the earth and on the planet, which is largely driven by wanting a $1 trillion economy and wanting to do things 1 month in 1 day. So loneliness is a consequence of a fast changing world, a rapid paced world, and a world which does not look on the side. Metaphorically, when we were driving a bicycle, we would look all around. In a bike, we became faster. In a Fiat car, we were still faster. Now, when the vehicles are racing and planes are flying at jet sets at great speed, and trains with all ACs and cars having ACs, the disconnection is huge across rural India and across urban India. And one of the adverse effects is increased suicides across the country. 1 out of 7 being mental ill, increased hypertension, increased diabetes, and a host of other illness. US Surgeon General has
physical ailments, of course, follow.
Diabetes can be
let me take this across to Deepak Seni. Deepak, हमारी generation के लिए ये कहा जाता है कि we are a generation of happy faces and sad hearts. As a comedian, as somebody who's in the public life, आप ये देखते हैं अपनी audiences में जब आप interact करते हैं लोगों के साथ कि एक disconnect है, एक temporarily आपके साथ जो they may be laughing, they may be smiling, बट एक कहीं तक एक पॉइंट तक डिस्कनेक्ट है.
हाँ, देखिए आपने बिल्कुल ठीक कहा है कि आज के ज़माने में लोग थोड़ा डिस्कनेक्ट तो हैं। सोशल मीडिया और मोबाइल के ज़रिए तो पूरी दुनिया से जुड़ रहे हैं, लेकिन अपने आप डिस्कनेक्ट हो जाते हैं लोग। और जब हम जाते हैं हँसाने में तो लोगों को एक तो सोशल मीडिया ने ऐसा बना दिया ना, सारा सारा दिन आदमी बात करता है, तो जब वो असली में किसी से बात करता है तो ऐसा लगता है कि कुछ ये अब ये वाला ज्यादा फर्जी लगता है सोशल मीडिया के मुकाबले किसी से असली में बात करना। और मैं तो यही सबको कहना चाहता हूँ कि कुछ ना कुछ क्रिएटिविटी पैदा कीजिए अपने अकेलेपन को दूर करने के लिए। एक क्रिएशन ही ऐसी चीज है जो आपको अकेलेपन से डाल सकती है, वरना आप अकेले में करोगे क्या। हालांकि आज के समय में वैसे तो किसी के पास इतना टाइम इंडिया में तो खासकर नहीं है कि वो खाली बैठा रहता है सारा दिन, सबके पास बहुत सारा काम है और कुछ ना कुछ आदमी लगा रहता है। लेकिन क्रिएशन जब आप करना शुरू कर देंगे या क्रिएशन की तरफ बढ़ेंगे तो अकेलापन दूर होगा। और खुद को जितना आप अकेला फील करोगे, कोई दुनिया में आपका अकेलापन दूर नहीं कर सकता जब तक आप खुद से ही खुश नहीं रहोगे तब तक।
Okay. Dr. Vikramendra, the irony of this whole situation is that today we're living
Yes.
in an era where we talk about yoga, where we talk about meditation, where we are more aware, perhaps from the previous generation, of mental health issues, of how we are so connected with each other through social media apps. We have people getting together in each other's homes, they're meeting outside. Yet, the problem of loneliness persists. Why is that?
Yeah, of course, we are connected with social media and many other things, but at the same time, we are unable to socialize ourselves. We are not able to share our feelings towards our family, towards friends, towards our peer groups, and that's why problem is surfacing. In these days, everybody is facing different sorts of problems, but we are unable to connect ourselves to the family members, to the friends, to the peer groups, etc. And because of that, we feel that I am alone. Because of that, we feel that I am secluded, and because as a result, multiple problems are cropping up. Yeah.
Okay, Dr. Harish Shetty, do you think this problem of loneliness has also been pushed further during COVID and after the lockdown and the whole social isolation that all of us had to go through that time? Do you think that sort of aggravated this problem further?
Absolutely. But many sociologists have said in the past, 150 years ago, that alienation would be the biggest disease in this century, and COVID actually aggravated it. But what is very important is disconnection, as somebody just mentioned, my friend mentioned, is the biggest illness, and reconnection is one of the answers. But what we also see, and we need to understand, is when we have more time, we share feelings and thoughts. When we have less time, we just say, आज बिल भरना है, कल बैंक जाना है, परसों शादी में जाना है. So restricted time stops us from sharing feelings. And that is the biggest casualty. Globalization and the rapid pace has caused little time to interact with people. And when the mind is crowded by a lot of thoughts, my EMIs, my farm, my income from my farms, from my office, my new house, my second car, all this stops you from going away, it makes you go away from people. And at the same time, gadgets have caused loneliness. In the past, we used to talk in the trains while traveling in Bombay. We used to talk to our neighbors. We used to sing songs, sing bhajans, film songs. There were groups. Now everybody is watching his mobile. Gadgets also, as the United States of America Surgeon General has said, has caused social isolation. And that has also aggravated loneliness. At home, when there's little time after a hard day, people don't talk to each other. They're attracted to gadgets and meaningless watching of the social media. That has also aggravated loneliness. Small families, no joint families, little houses, matchbox houses, and long working hours along with gadgets are a suicide cocktail and a loneliness cocktail.
Okay. Let me take this across to Deepak. Deepak, past में एक्टर्स लाइक मिथुन चक्रवर्ती, हॉलीवुड से जूलिया रॉबर्ट्स, इन सब ने बात की है कि स्टारडम के एक पॉइंट में आके जब हम सक्सेसफुल हो गए तब हमें लोनलीनेस बहुत फील हुई. ऐसा क्या होता है कि आप यू आर सराउंडेड बाय पीपल, आपको बहुत प्यार भी मिल रहा है, आपको रिस्पेक्ट मिल रही है, जो करियर में आप सक्सेस चाहते थे वो भी मिल रहा है, और ये सिर्फ उनकी बात नहीं है जो पब्लिक आई में है, जो सेलिब्रिटीज हैं. आप किसी भी एमएनसी के एम्प्लॉय को उठा लीजिए, कहीं से भी बात करिए, जैसे जैसे सीढ़ी आप चढ़ते जाते हैं वैसे वैसे लोनलीनेस क्यों आती जाती है?
सेलिब्रिटीज के लिए आपने बोला तो उनके लिए तो क्या है कि वो सब कुछ देख लेते हैं पूरी दुनिया में, जो जितना ग्लैमर की सीढ़ियां सब चढ़ जाते हैं, उसके बाद उनके जीवन में कुछ बचता नहीं है. तो ये तो कॉमन बात है. लेकिन जो WHO ने कहा है और जैसा डॉक्टर साहब ने भी बोला कि हम गैजेट्स की वजह से हम लोग एक दूसरे से बात नहीं करते हैं, ये बिल्कुल उन्होंने ठीक कहा है. अब देखिए, घर में 4 आदमी यदि हैं तो चारों लोग अपने मोबाइल पे लगे हैं, हम लोग बात ही नहीं करते हैं. जहां हमें दिल खोल के बात करने चाहिए हम लोग फोन खोल के बात करते हैं. एक हॉस्पिटल के बाहर एक बड़ा प्यारा शेर लिखा हुआ था, यदि उसके सार को समझा जाए तो मुझे लगता है कि जीवन का सार यही है. उस पे लिखा हुआ था, खोल लेते दिल यदि हंस बोल कर यारों के साथ, खोल लेते दिल यदि हंस बोल कर यारों के साथ, तो यूं ना खोलना पड़ता औजारों के साथ.
Yeah, perfectly sums up what the challenge is in front of us and what we need to do about it. Dr. Vikramendra, Dr. Shetty also talked about how the family structure has changed in our society. Pehle there used to be joint families, grandmothers, grandfathers, uncles, aunts, everybody staying together. There was a lot of, social connection. जो बाहर आप जाके करते थे, perhaps at home you were starting off with your socializing skills that you were picking up. But today, with nuclear families, with a single child concept, that has really shrunk, hasn't it?
Yes, yeah, surely. I mean, because of the changing scenarios in the global context, we are very much confined to our own household, and we are not talking much to what is happening to other parts of the world. We are concerned with our own family, and because of urbanization, primarily, I would say that joint family has disintegrated. We are seeing more and more nuclear families. Even with the nuclear families, people are working, and kids are alone. So this generation is growing up in a very difficult circumstances where only they are themselves restricted to the mobile gadgets. And parents, when they come from working hours, they only see the children. Sometimes when their children are sleeping, they come at 9 o'clock, 10 o'clock, and children are sleeping. So this contact point is missing with the children, and as a result, even kids are also facing tremendous problems. I don't know. I mean, it's very difficult to handle the situation because also the temperament of youngsters or youths have changed. People sometimes feel that nuclear family is better, but they don't know the consequences of it, and they have to suffer a lot in the due process of time when everything is lost and things are well at the long term of the time. So I think we have to change. We have to start thinking right now what else we are trying to do, and we should socialize more and more so that these sorts of problems should not crop up in the near future. Yeah.
Okay, Dr. Harish Shetty, there's also the concept of individualism, and that came in when people started to get ambitious. They wanted to think of themselves, and nothing wrong with that. Nothing wrong with, being ambitious and thinking that you want to step up and you want to move forward in the career ladder and you want to make a name for yourself. And even if not professionally, even personally, that concept of individualism has come in. And that came perhaps because in joint families, people were not getting their private space. So there are two sides to the same coin, isn't it?
Individualism also is a phenomenon of the West, where I was more important and we was not. India, it was always we, but now I is more important. And what is also very important is the indicators of loneliness. More stand-up comedians, more gurus, very less people among funerals. And also what is very important is that when you aspire, you always look on your side. There is no togetherness. You look across the shoulder. There is no togetherness. There is me, and I will aspire. Nothing wrong in that. Aspirational India can also get reconnected. So what is extremely important is one experiment done in Gujarat by a religious organization where they structured a Ghar Sabha. A Ghar Sabha means a fixed time when family would sit down and meet and talk. So we need now structured interventions to break loneliness. Generic answers may not catch the imagination of people. So writing on the prescription that family time, half an hour at this time to this time, might actually break the phenomenon of loneliness. Also, the travel outside my salary, my package, my incentive, my job, my promotion. But the journey inside, where awareness of self, awareness of your feelings, awareness of your thoughts, awareness of your relationship, and awareness that we are connected to a larger world, to a cosmic world. And each person individually is connected to each other. So this is something we need to bring in. A lot of people go for yoga and they feel connected. A lot of people do Vipassana and they feel really connected. So what is extremely important is India has a lot of activities which can promote, stimulate, and facilitate reconnection, even in a world which is grossly disconnected. We need to really bring our cultural answers to disconnection in a modern world.
Okay. Deepak, 5 to 15% teenagers जो है उनका रिपोर्ट किया जाता है कि वो लोनली फील करते हैं एंड आई एम श्योर 5 to 15% एक अंडर एस्टिमेशन है वो रिपोर्टाज नहीं होता है कईयों को पता भी नहीं लगता है दैट दे आर लोनली बट एज अ स्टैंड अप कॉमेडियन आपका बहुत इंटरेक्शन रहता है यंगस्टर्स के साथ क्या फील करते हैं आर दे रियली लोनली क्या चलता है दिमाग में सब कुछ है आज के टीनेजर्स आज के बच्चों के पास जो परहैप्स हमारे पेरेंट्स की जनरेशन के पास नहीं थी हमारे पेरेंट्स तो सिर्फ दे वर ट्राइंग टू मेक एंड्स मीट जो बेसिक्स था वही इकट्ठे कर रहे थे जिंदगी भर पर आज के बच्चों के पास आज की जनरेशन में ऐसी कोई प्रॉब्लम नहीं है दे हैव एवरीथिंग येट द प्रॉब्लम परसिस्ट्स की लोनलीनेस है एक आइसोलेशन फील होता है जबकि सब कुछ है उनके पास
आपने बिल्कुल ठीक कहा है हमारे जनरेशन में ही नहीं था हमारे जनरेशन में बहुत सारे ऐसे बहाने थे जब हम सब लोग इकट्ठा हो जाते थे ज्यादा कोई बहाना नहीं होता तो कम से कम सब लोग टीवी के सामने पूरा परिवार बैठ जाता था तो सब एक साथ एंजॉय करते थे न्यूज भी देखते थे तो सब लोग एक साथ देखते थे अब मेरी छोटी भांजी है जब वो घर पे आती है कभी तो फोन लेके बैठ जाती है फोन लेके घंटा फोन में टिक 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 करती रहती है उसके बाद आके बोलती है मामा मुझसे कोई बात ही नहीं कर रहा तो बात क्या करेंगे बच्चे तो फोन में लगे हुए हैं तो अब इसका ये तो है कि लोनलीनेस तो है लेकिन इसका समाधान क्या है इसका सोल्यूशन ये है कि मैंने जैसे कि पहले बताया हमें क्रिएशन की तरफ बढ़ना पड़ेगा अपने आप को ज्यादा फोन को साइड में रखे जितना ज्यादा से ज्यादा क्रिएशन कीजिए म्यूजिक से जुड़िए बुक्स पढ़िए गीता पढ़िए रामायण पढ़िए जैसे मैं माउथ ऑर्गन बचपन से बजाता हूँ तो मैं कभी भी लोनली फील नहीं करता मुझे जब भी कभी कुछ नहीं होता तो मैं माउथ ऑर्गन उठा के रात में 2 बजे भी बजाने लगता हूँ बड़ा अच्छा लगता है हालांकि हास्य कलाकार सबसे अकेला प्राणी होता है इस पूरे संसार में सबको हंसाता है वो ये सबके साथ है तो अब आजकल की जनरेशन क्या है कि वो वर्चुअल वर्ल्ड में जीती है उनको असली में बात करना ज्यादा वर्चुअल लगता है वर्चुअल के मुकाबले ये प्रॉब्लम आजकल की यूथ के साथ है और हमारे जमाने का ह्यूमर और आज के जमाने का ह्यूमर भी बदल गया है जैसा कि आपने मुझसे एज ए स्टैंड अप कॉमेडियन पूछा हमारे जमाने का ह्यूमर ज्यादा अच्छा ह्यूमर था आजकल के बच्चे वो 4th क्लास और 5th क्लास वाले जोक्स पर भी बहुत जोर से तालियां बजाते हैं उनको लगता है कि बहुत कोई बड़ी चीज हो गई है तो उसके बाद उन्हें कुछ बचता ही नहीं है क्रिएशन के नाम पे आईक्यू लेवल बच्चों में आजकल बहुत कम हो गया है और मतलब टेंशन तनाव में रहते हैं पता नहीं कि सब कुछ होते हुए
स्टैग्नेशन आ गई है ना इमोशनल एंड इंटेलेक्चुअल स्टैग्नेशन आ गई है शायद हाँ अच्छा दीपक मुझे एक बात बताइए क्या कॉमेडियंस को भी लोनली फील होता है जो सबको हंसाते हैं जो दुनिया को हंसाते हैं उनको क्या लोनली फील होता है क्या और कैसे ओवरकम करते हैं वो इस चीज को
कॉमेडियंस को होता है मैं तो इतना बड़ा कॉमेडियन नहीं हूँ मेरा तो कॉमेडी में केवल इतना योगदान है जितना हमारी क्रिकेट टीम में अनुष्का शर्मा का लेकिन जो बड़े बड़े कॉमेडियंस हो चाहे उमर शरीफ हो जॉनी लीवर हो राजू भाई हो सबको अकेलापन फील होता है, क्योंकि हम जब अकेला बैठ के सोचते हैं कि क्या नया क्रिएट करना है, वो अकेले में हो सकता है। हम जो बाहर सारा दिन जो पूरी दुनिया में देखते हैं, रेल में, जहाज में, ट्रेन में, गलियों में, सड़कों पे, वो हम जाके फिर रात को अपने अकेलेपन में उसको करते हैं कि भाई अच्छा हमारे वो जो इंटेंशन है, हमारा आईक्यू है, वो समझने वाला कोई होता नहीं है सिवाय ऑडियंस के। घर में कोई नहीं समझता है कि हम किस फील्ड में चल रहे हैं, कोई भी छेड़ देता है। और मैं आपको बताऊं, मैं तो हरियाणा का हूँ, वैसे भी हमारे तो यहाँ संयुक्त परिवार होता है, जॉइंट फैमिली होती है। हमारे यहाँ लोनलीनेस नाम की कोई चीज होती नहीं है। हमें तो ये निकालना पड़ता है कि यार हम अकेले कब होंगे, हमें टाइम अकेला मिलेगा कब। हमारे यहाँ उल्टा है।
Yeah, yeah, I think that acceptance, that recognition that loneliness and mental health issues are actually a big invisible challenge that we go through is still coming into our country, is still being understood. But Dr. Vikramendra Kumar, it's very easy and convenient for us as adults to say that youngsters use a lot of gadgets and they don't look anywhere, they don't see anywhere, and that's why they feel isolated because they're using a lot of their mobiles and iPads and iPods. But the fact of the matter is that they are looking at us, right? They are looking up to us. We are their role models since the time of their birth. We are the first adults that they look up to. And if we sit around with our gadgets in front of them, or, just to make things easier for us while feeding them, we give them the iPad to watch something, then it's our responsibility as adults as to what we're leaving for the next generation.
Yeah, so I mean, of course, I mean, kids don't know what they are supposed to do most of the time. I mean, whether they are eating and they are demanding that I need mobile phones to eat something like that. This is almost just like a horrible situation. So here, it's the role of parents or adults becomes more important. How they are trying to sensitize the thing, how in a better manner they are trying to involve themselves with the kids, and that is how so at some point of time they can be more fruitful in suggesting their kids, children's, that more and more we need to socialize ourselves, we need to attach ourselves towards more ethics, and that is how we will be able to remove these kind of problems. I think there is an easy way that if we are unable to control kids, let's give this thing, let's give that thing. But we are not going towards the root problems which we are facing. I think we need to connect ourselves more and more towards the youngsters, youths, and that way we will be able to wipe out this kind of rampant problems which we are facing. Otherwise, this will be a huge crisis in the near future. Let's be alert right now. Especially to the parents, I would say that they should be more sensible towards dealing with their children, because you cannot say, this is also, you cannot say directly that stop using mobile phones or tablets right now. There should be another different mechanisms should be adopted to treat children in a sensible manner, and that is how I feel that things can be normalized in a better manner. Yeah.
Yeah. Here, what you mentioned, Dr. Vikramendra Kumar, I agree that a lot of things kids don't know, but perhaps the flip side to it is that as adults, we should be learning from the children. You give them one crayon in the morning, they'll be playing with it till the afternoon without any cribbing, without any complaint. So I think as adults, we need to unlearn a lot of things and learn from children. When we are with them, on how to be happy with the simple things, the small things in life. But just to give you a last word, Dr. Harish Shetty, quickly, if you can tell us how do parents and how do we among each other identify when somebody is going through loneliness, and how do we take steps to help that person out?
When somebody is sulking, when somebody withdraws himself or herself into the room, when somebody is irritable, that means he's asking for attention. When somebody sleeps less, eats alone, would not want to share his inner feelings with anybody, also would be very, very avoidant towards social situations, because the mind becomes like a stone, and loneliness and depression can coexist. And that's the time others who watch such people should drag this person back among people, and also check whether it's only loneliness or depression. Among kids, very important, they are attending 3 schools, 3S syndrome, school, classes, and mom's tuition. Number 3 is gadgets are designed to be addictive. UNESCO report says 1 out of 4 countries in the world have restricted the gadget use in school. So we need to have a combination of factors. And one experiment in Maharashtra is something I would like to share. In a village in Maharashtra, which is known as Mohite Vadgaon, the people have come together and they would hit a siren when everybody have to really drop their gadgets and meet everybody and do that task. My dear friends, today loneliness is an epidemic. And to fight an epidemic, we actually need a major activity. We need a campaign. It cannot be fought by simple parental advice. It cannot be fought by simple counseling alone, though they have an important part. But what is very important is we need to fight loneliness.
Can I also ask you a quick question before I wrap up, Dr. Harish Shetty? Between men and women, men are considered to be more of keeping their feelings within themselves. Do you think men undergo loneliness more than women?
Absolutely. But at the same time, men have started crying in this era. Men have started drying clothes of their wives and the children. Men have also started
Which
attending
is a great thing.
open houses in schools and colleges.
Crying without getting embarrassed.
And men have also started attending open houses in schools much more than before. I agree with you that men are more lonely, which is why they die of heart attacks and diabetes and also suicides. And women are very, very easy with their emotions. They're not ashamed of their emotions. So I tell all the men today, kill shame and seek help, reconnect. Reconnection is the biggest answer to fight disconnection.
Yeah. And I think that wraps up this discussion that we are having. Also, we need to reconnect. We need to go to the simple things, the basic things of life. And we need to express ourselves more and more as and how we feel it. Dr. Harish Shetty, Deepak Saini and Dr. Vikramendra Kumar, thank you very much, gentlemen, for speaking with us on Mirror Now and sharing your thoughts on this big problem that we are going through worldwide, that of loneliness. Thank you very much. Namaskar.